Hey, my name is Andreas and I'm the founder of mindbodyconnection.org. We help high-performing professionals get out of chronic pain by using clinical hypnotherapy combined with the latest insights from pain research and neuroscience. Today, I want to speak with you about using medication to treat chronic pain and the vicious cycle that it can create. You see, the model that we're treating chronic pain with is a one-size-fits-all model based on old research. And that one-size-fits-all model is essentially using opioids and other types of painkillers to kill chronic pain. But that's not really how it works, because these kinds of medications, they don't treat the underlying issue. They simply subdue the brain's ability to feel the pain in the moment when the drugs are active in the system. But none of the underlying issues are addressed by these medications. And the problem is that using these medications have side effects and other consequences that produce perhaps even more pain, as we'll get into. Let's go straight ahead and look at some research. So in this study, this is called Analgesic Efficacy of Opioids in Chronic Pain. And it's a meta-analysis. It looks at 46 studies with more than 10,000 participants. And in the study, they look at how does strong opioids, weak opioids, and non-opioid painkillers, how well do those work in relation to a placebo. And this is for chronic non-cancer pain, okay? So that's usually most types of chronic pain, like back pain, neck pain, and so on. And in the abstract, the authors open with, opioids are regularly administered in acute and cancer pain. In chronic non-cancer pain, however, their use is controversial. And the key takeaway from this study is that on a scale of pain reduction, on a 100-point scale, so 0 is absolutely no pain, and 100 is the absolute maximum pain you could imagine, then first they look at the placebo. So they give the people a sugar pill, and they don't know if it's real medicine or real painkillers or if it's just a sugar pill. But it is a sugar pill. So first they look at how effective is that. And then they look at how much better is the painkillers related to the placebo. So on a 100-point scale, strong opioid painkillers were only 12 points better than placebo. And that's not a lot. If the placebo had an effectiveness of 10, like reducing pain from 100 to 90, then strong opioids would take it to a 78. And the authors don't really consider this a clinically significant amount of pain reduction. And that's for the strong opioids. The weak opioids come in right behind at 10.6, and the non-opioids come in at 8.4. And we're not going to read the whole study, but they do conclude that opioids alone are inappropriate for treating chronic pain. Now, let's move on and have a look at consensus. So what you're seeing on the screen right now is a query made in consensus.app. And this is a research tool using AI to summarize a lot of different studies. And it will give us a summary of the research. It will also give us a consensus meter, indicating visually, is this a controversial topic? Is it a clear yes? Is it a clear no? or is it somewhere in between, which most research usually is. We'll also get some more interesting facts and things to consider. And also, it will, of course, give us all the referenced studies. So the query I made is, are opioids an effective treatment for chronic pain? And it's quite clear, even though the consensus meter puts a yes at 47%, there's a lot of caveats in there. So the summary tells us, while opioids can provide short-term pain relief for some chronic pain patients, evidence for long-term effectiveness is weak, and risks, including dependence, overdose, and side effects, are significant. So it goes on to tell us that in the short term, it's more effective than placebo for reducing pain intensity with modest improvements in pain and some physical function, but high rates of side effects. And for the long term, it just gets less and less effective. So the problem with painkillers is that they work for a short amount of time at a time. So you'll have to keep taking them, but they will only subdue the pain while they're active. They don't really treat the cause of the pain. And the side effects are the big problem. Opioids are addictive, which is a problem in and of itself. But there's also side effects like brain fog and fatigue. And one of the most treacherous kind of side effects that I wasn't even aware of until I saw it with my own eyes was the suppressing effect on the digestive system. So let's look at this. What effects does opioids have on the digestive system? Consensus says that opioids significantly disrupt digestive system function, most notably causing constipation, delayed gastric emptying, and a range of gastrointestinal systems. Spoken in a more everyday language, it means constipation. Since opioid painkillers work on your entire system, having like a suppressing, subduing, down-regulating effect, it will make your digestive system work more slowly. So in our digestive system, there are movements kind of helping the digestive system and the process along. These movements will start to turn more slowly. And in addition to that, less fluids will come into the system to help digesting, and everything just slows down. And the result is constipation and everything that comes with that. When constipation gets severe, there's also a tendency to get nausea and even vomiting. So there's a lot of discomfort and now more pain coming as a result of using opioid painkillers. And going to the bathroom after you have been really constipated can be a very painful situation to deal with. So this causes more stress and more fear, which we now know increase our susceptibility to pain. So pain gets worse when we're stressed and when we're afraid. So now, if you're using painkillers long-term to treat chronic pain, then you're in pain when you're not using the medication. But when you are using the medication, you're producing more pain as a result of these digestive issues. And then these digestive issues cause even more stress and more fear, increasing the pain yet again. And now you see how this vicious cycle is starting to form. And To deal with that, many people have to use laxatives to get their system working again. But laxatives produce even more problems. So a lot of laxatives, you can take them, and it tends to produce a lot of gas, which creates more pain and more discomfort yet again. So now you take the medication, you get constipated, you have painful bathroom visits and so on, and you're stressed about it, and you start to become fearful of going to the bathroom because it hurts, which again slows the digestive system down even more because of the fear and pain. And now to try to handle this, you use laxatives, and they produce so much gas that there's more pain again. So the treatment produce side effects that require more treatment that produce even more side effects. It really breaks my heart because I saw all of this happen with my mother. This is why I know these effects. I've seen it with my own eyes, and I know just how much stress and pain and fear can result from this type of dynamic. And I didn't know about this, and I bet a lot of people who get pain medication don't either until they experience it for themselves. And then they might be too far along in the vicious cycle. However, there's also good news. You see, one thing that we have discovered over the past decade is that a lot of people with chronic pain, they suffer from something called neuroplastic pain. And what is neuroplastic pain? Well, you see, neuroplasticity is a term used to describe how the brain is able to change and adapt and learn. All right? So neuroplastic pain is when the brain learns a habit of producing pain. So if you have an injury, let's say you injure your back, when there's physical injury or a disease, any just physical reason for pain, then the nerves in the area will send messages from the nerves through the spine and up to the brain. And the brain will interpret the pain signals, and then the brain will produce the pain that you can feel. In neuroplastic pain, if you had an injury, the brain might actually learn the habits of producing this pain that you feel, even though the injury has healed and there's no physical damage to the body, no physical damage to any tissue. Still, the brain has the capacity to produce this very, very real pain. So why does this happen? Well, you see, pain is the brain's protection mechanism. If you are out on a run and you roll your ankle and you mess it up really bad, that pain signal, it keeps you from running even more and damaging your tissues even more, potentially making it worse, right? So the brain is telling you, hey, there's something you need to pay attention to here. But the brain is smart and it will take context into account. And this is how the brain will actually interpret pain before it puts the pain into your awareness. So if you had rolled your ankle, you're just out on a leisurely run or whatever, and you roll it, you mess it up, and it hurts. And it will likely hurt so bad that you will stop running, maybe even stop walking, maybe have someone pick you up or get you out of there, right? But if you were being chased by a pack of angry stray dogs down the street, your brain would think, I don't care about this rolled ankle right now because I'm about to get eaten by this pack of dogs. So the brain will just downregulate all that pain in the ankle and just keep you running until you get out of there. Because in the hierarchy of the brain's priorities, survival is always on top. So then injuring your ankle by running on it, even though it's been rolled over and it's painful, that doesn't matter if survival is at stake. So that's how the brain interprets context and then produces pain. So what happens in neuroplastic pain is that you can have an injury, or sometimes there's not even an injury, but the brain can retain the habit of producing this pain to keep you safe, even though the injury is not there anymore. So it's like the brain is misinterpreting signals of danger and is trying to keep you safe. And the fantastic news is that since this kind of pain is learned as a behavior by the brain, it can also be retrained. And pain can be reduced and possibly even eliminated in a lot of cases. It's important that you know that even though this kind of pain is caused by the brain and it can be retrained with mental strategies, that doesn't mean that it's your fault that you're experiencing it. That's just, let me just make that extremely abundantly clear. This is not one of the things or one of the therapeutic modalities where you're asked just think positively or just stop worrying about it. No, this is not it. Neuroplastic pain is very, very real. Okay? But there's hope because it can be retrained. And you can retrain your brain to reduce neuroplastic pain. And this is what we are specializing in at mindbodyconnection.org. Now, if you have chronic pain and you want to know if it might be neuroplastic, then there's an assessment you can take, and you'll find a link below in the description of this video. And in the assessment, you will be asked 17 questions, and at the end, you will have an indication as to whether or not your pain might be neuroplastic. And if it is, then it is very likely to be effectively treated with mind-body therapy. That's it from me today. Ask me your questions in the comment section below. And if you want to see more videos like this, feel free to subscribe to the channel. Now, please enjoy your day, and I'll see you in the next video.